Hi, I'm Dr. Rob Danoff for ARIA Health Medical Mythbusters. All right, you ready? Here was the question. Is this a myth or is this a fact? If you or a loved one has uncontrolled diabetes, one of your greatest health risks is cardiac disease. And by that I mean heart attack and stroke. Was that a myth or is that a fact? Well, what do you think? I know you're all thinking, wow, I do know someone with diabetes, or I have it. Is this true or is this false? Well, the answer is it's a fact. If you have uncontrolled diabetes, it's taking a big toll on your cardiovascular system, and you are at a higher risk for heart attack and stroke. But that's not all. You are also at a higher risk for loss of vision. You're at a higher risk for kidney disease, possibly kidney failure and needing a new kidney. You are also at a higher risk for losing your limbs. Yes, limb amputation is big for those who have uncontrolled diabetes. And let me throw something else out there. Have any of you ever had like your leg fall asleep or your arm? You know that tingling numbness? Well, could you imagine? You can also get nerve damage. And imagine walking around with a foot that feels like it's asleep. You don't even know where you're stepping. Well, all those are potential complications of uncontrolled diabetes. So why is this a problem? Well, 26 million Americans have this, and of them, about 90 to 95% have what's called type 2. Type 2 diabetes is something where either our body does not make enough insulin to get that excess blood sugar from our blood into the cells for energy or into our muscles, or our body has insulin, but it doesn't sense it. It doesn't respond to it. As a result, we have all this extra sugar circulating in our arteries and in our veins and in our organs. So what's the big deal? Well, guess what? Sometimes you can have high blood sugar and not have any symptoms at all. Meanwhile, over these 5 or 10 years without symptoms, it's causing damage to many areas of your body. And then all of a sudden you may get symptoms where you're thirsty, where you have unexplained fatigue, where you might have this tingling or numbness or blurriness, or increased urination. And all of a sudden you find out you have diabetes. So what can you do? The first thing to do is please go to your doctor and get checked. Get a screening questionnaire to see if you're at risk for diabetes. And then if you are, we have different types of blood tests. There's something called A1C, or we can get a fasting blood test, fasting blood sugar. Talk to your doctor and see what's best for you. And I'll tell you why. Even if you don't have diabetes, you may have what's called prediabetes. About 70 million Americans out of a population of about 320 are walking around with high blood sugar. And if we don't identify this and help you get that under control, you can develop diabetes. We don't want that to happen. So here's some things you can do. 1, get checked by your doctor. Get a blood test. 2, if you have high blood pressure, please have your sugar checked, because a lot of people with high blood pressure have elevated sugar. Also, 3, if you are inactive, get a moving. Try to move, have increased activity, exercise about 30 minutes a day, at least 5 days a week. And if you don't have enough time to do it 30 minutes in a row, you can break it up 10 minutes there, 10 minutes here. Gardening, cleaning your house, yes, that's exercise. Walking stairs instead of taking the elevator. So activity. Also, forget about the fast food. Forget about it. You know, no diet works well if you're not eating good food. So besides activity, you need to have good food. So try that. Also, if you have had pregnancy-related high blood sugar, what they might call diabetes of pregnancy, you are at a greater risk later on of developing diabetes. So it's very important to talk to your doctor. Also, if you have high triglycerides, you are at a higher risk of getting diabetes. Fortunately, there's a lot we can do to prevent it, such as weight loss. Give me 7. What does that mean? 7% weight loss. So if you're 200 pounds, you lose 14 pounds over this year, you're decreasing your risk of getting type 2 diabetes. And if you already have it, weight loss actually can act like a medicine. So if you're on 3 medicines or 4 and you lose weight, we may be able to get you off 1 medicine. And the other thing is activity. That's so important combined with eating well. So those are all great skills to do. For further information on how to help yourself if you have diabetes or you're trying to prevent it, go to yourariahealth.org.